Hi, I'm Sarah Lynch. I'm the Director of Skills Education here at Binghamton University School of Pharmacy, Pharmaceutical Sciences, and I'm also a Clinical Associate Professor. I wanted to welcome you to our Skills Lab space that we have here within the School of Pharmacy. We're located on the second floor, and this space consists of a variety of different spaces that students use to learn from their first through third years of pharmacy school. We use this space to be the bridge between the didactic classroom learning and the experiential setting where students will be expected to apply their knowledge and information with real patients and with real healthcare providers. So we make this a very safe place where we simulate a lot of experiences so students get that practice before entering that true pharmacy practice setting. Beyond me right here is our main classroom setting where we often start out with our learning and preparing for the session at hand. This space is very flexible. We can move the tables around so students can work in groups or they can work more independently. We can have task trainers out here, and we can also have small lectures or instructors teaching within this space. Follow me and I'll show you the rest of the spaces that we have and talk a little bit about how we use this space for learning. This room is one of 8 alcoves that we have that are located off of the main learning space. Students will use this space to interact with our standardized patients who we bring in from the community to play the role of a patient so that students can practice their communication and education about medications and devices within a safe space here. We also have our cabinets stocked with OTC products, and we have the space set up to look like a doctor's office so it can be used by both our early learners to prepare to talk to patients about self-care and OTC medications, as well as our later learners to have more involved conversations, doing things like medication therapy management and motivational interviewing. The space is equipped with a camera that can record the sessions that take place in here. Instructors can use this to view the sessions and provide feedback to students, and students can also view these videos after their sessions to watch and provide themselves with self-feedback in order to learn from the experiences that they have within this space. We're now going to enter our community pharmacy, which is set up to look like a dispensing or retail pharmacy that you might see out at a chain or within a grocery store or even within another type of healthcare setting. This is the environment where patients will come to pick up their medications that their doctors have prescribed. And this type of setting is one of the first experience that first-year pharmacy students have after they complete their first didactic year of learning. The students will go out into the community setting and interact with patients. They'll talk with healthcare providers, and they'll learn directly from pharmacists at various pharmacy sites. We use this space during the first year of pharmacy school to prepare students to work within those settings, doing things like using dispensing software, counting out pills, using the various types of technology that are available. We have a robotic dispensing machine that's used to count out medications to take the pharmacist away from that actual counting process to be doing more clinical aspects. And we have students practicing using technology like barcode scanning and other technology that can avoid medication errors. We now enter our hospital pharmacy space, which is set to look like a pharmacy that's located in the institutional type setting, like a hospital or a mental facility or even a long-term care facility. Within this space, students might do things like prepare medications for a medication cart, which would be delivered to the floor and administered by a nurse or a nurse assistant. We also have a pass-through, which can be used to pass medications through from the clean room, where sterile IV bags are prepared, to out here where labels and verification can be done within this setting. And finally, we have our hospital spaces located here at the School of Pharmacy. We have 3 of these hospital bays where students can practice and simulate being within that full hospital setting. We have 3 adult mannequins and we have 1 child mannequin. These are high fidelity mannequins that can do things like simulate vital signs. They can talk to the patients and respond. They can react to certain clinical maneuvers that are done on them and medications that are administered. And the students have the chance to interact with a variety of different patients from different backgrounds when we use these high fidelity mannequins. We do things like simulate infectious disease situations, seizures, we can run codes in these spaces, and we can have our students experience working with other healthcare professions at the bedside as part of an interprofessional healthcare team. Finally, we can take a look at our clean room setting. Students use these spaces to prepare IV bags within their compounding labs. And as I mentioned before, we do have the pass-through space, so once students have prepared those products in the hoods in that very sterile and clean setting, they can pass those IV bags through and they can be then labeled, verified, and delivered to the patients who need those products. We end our tour in our home care space, which is also used as an extension setting that we use for small group learning within this space. We do have a TV back here, which we can use to view either live or recorded simulation sessions that are taking place throughout the Skills Lab space to discuss and learn and talk about those with both the students and the facilitators or instructors for those sessions. We also have a small living room set up here where we can do things like simulate a telemedicine session or have students work with patients within their home space. We thank you for coming to join us today and look around our Skills Lab spaces here at the School of Pharmacy at Binghamton University.